Hello, I'm Louise Marsh. I founded the Evergreen Care Trust just over 18 years ago now. I came into this role as a long-term health and social care practitioner. Initially, I did my nurses training in Sydney, Australia, worked in the old Lincoln County Hospital, and then eventually specialised in the care of the older adult, studied gerontology and geriatrics, and worked for a number of years in the outback of northwest New South Wales, specialising in developing services for older people. Came over to Britain for what I thought would be 2 years and set up, did a whole range of things, one being running a nursing home in Inverness, and then came down to England and got involved with adult social care, still in the specialism of the older person. And it was during that period of time I discovered so many areas of need that were not being addressed by either health or social care. Very practical things like helping people tackle with loneliness and social isolation. So we set up a befriending project, being discharged home from hospital without family support. So we had a group of volunteers who would go to the hospital, meet the person coming out of hospital, take them home, settle them into their home, give them a cup of tea, get some essential groceries if that was necessary, and then we would visit them over the next 2-3 days and make sure that they had settled in well after their discharge home from hospital. We did clean team operations, blitzing properties in squalor, a whole range of volunteer activities that would just make things a little bit easier for sometimes older and vulnerable people who had no family, or perhaps their family were not close at hand. And so over a period of 2-3 years, we worked with a group of volunteers from across the churches in the Stamford, Bourne and Deepings area. And out of that, we developed what has become known as the Evergreen Care Trust. And so over the last 18 years, we've been able to touch literally thousands of people's lives and their families and their neighbours and their carers, and just be able to provide little interventions, little supports to help people stay independent, stay at home, and feel valued, feel connected to their communities, and know that they were not forgotten and that they were cared about. So we've developed the Evergreen Care Trust and the Evergreen Family for those people who use our services. And so now we've moved on from our early beginnings, 18 years down the line. It's a very different world out there. Some serious challenges in terms of recruitment and retention of staff, trying to attract people with the right values into this really, really worthwhile and incredibly rewarding work. But I, 3 years ago, handed over operations to a registered care manager, and I found myself fighting the cause, but on a different platform. So I'm now involved behind the scenes as a trustee still, but I'm involved in full-time employment in social care research and trying to address some of the issues that impact people as they grow older and as they need more interventions and support in order to stay at home, in order to live the life they want to live, and in order to feel like they still matter, that they're an important part of our community, which of course they really are. So Evergreen has done a long journey and continues to serve this local community, and we're very privileged and proud to be able to do so and have met some wonderful, wonderful people. So let me hand over to Caroline, who is our registered care manager and doing a great job of taking the work of Evergreen forward. Thanks, Caroline.